The daily number of cases has continued to rise. Based on the current trajectory, cases in the community are now doubling about every 10 days. Depending on how the trajectory will develop, we may start to see the number of daily infections rise to more than 5,000 next week.
Good evening, I'm Olivia Quay. Singapore may see 5,000 daily COVID-19 cases as early as next week, as the latest wave is showing no signs of slowing down. This according to ministers who held a press conference this afternoon. They stressed that the vast majority of infected individuals are asymptomatic or have mild symptoms and are suitable for home recovery. The percentage of patients who require intensive care is still low at about 0.2%, but there's one group that remains vulnerable: unvaccinated seniors.
If you zoom into the unvaccinated group, it is the unvaccinated seniors who are at the highest risk of needing ICU or dying. Therefore, it is very critical for unvaccinated seniors to take your vaccines. Please take your vaccines. And this is also why we are going all out through our mobile vaccination team, as well as our home vaccination team, to vaccinate as many seniors as we can. And today we have under 80,000 seniors unvaccinated. A couple of months ago, I remember the number we reported was 200,000. It has gone to under 80,000, but we still need to vaccinate as many of them as possible.
Well, vaccine booster shots are likely to be rolled out to healthcare and frontline workers, with the plan currently being deliberated by Singapore's Expert Committee on COVID-19 Vaccination. Moving on to the situation in the migrant worker dorms, which are seeing a rise in cases, with 818 reported yesterday. Well, Manpower Minister Tan See Leng said the vast majority are mild or asymptomatic who don't require hospitalization or oxygen support and are able to recover on their own. Dr. Tan noted that despite the continued surveillance in the dorms, cases are still on the rise due to the highly transmissible Delta variant. And so the Manpower Ministry will look at adjusting the health measures for dorm residents.
We will align public health measures for migrant workers in the dormitories to the latest healthcare protocols for the community as prescribed by the Ministry of Health. This will enable us to further mitigate the risk of further transmissions in the dormitories in a more scalable and also a more sustainable manner. It will allow us to focus our attention on the symptomatic cases and those who need medical care without disrupting the livelihoods and the lives of the other workers.
Well, three key areas. First, MOM will increase the use of fast and easy tests to make testing more convenient and faster to quickly detect infections. Moving forward, MOM will progressively shift towards using only antigen rapid tests for rostered routine testing. Second, MOM will tighten contact tracing rings. Instead of quarantining entire blocks or sections when new cases are detected, quarantine orders will only be issued to roommates of PCR-confirmed cases. The quarantine period will also be reduced to 10 days from the date of last exposure to the confirmed case, with workers to self-administer ARTs from day 11 to day 14. And third, fully vaccinated workers who test positive and are asymptomatic will be allowed to isolate and recover in a dedicated facility within the dorms for up to 10 days. From November, long-term pass holders must be fully vaccinated before arriving in Singapore. This applies to work pass holders and their dependents, as well as travellers under the student's pass holder lane. Well, there are exceptions, like those younger than 18 years old. Unvaccinated people between 12 and under 18 at the point of arrival can enter without proof of vaccination on the condition they complete the full regimen within 2 months after they arrive. Pass holders who are medically ineligible for vaccination can appeal to be exempted from the requirement supported by a doctor's memo and before applying for entry approval. The Health Ministry will also be resuming entry approvals for migrant domestic workers as well as S-Pass and work permit holders from the construction, marine shipyard and process sectors who are arriving from higher risk countries and regions, and on the condition that they are fully vaccinated before arrival. Separately, from 11:59 p.m. on October the 6th, border measures for incoming travellers will be determined based on their recent travel history in the last 14 days instead of the current 21 days. The stay-home notice period will also be reduced to 10 days in line with the shortening of the quarantine period. The latest COVID-19 curbs were introduced a week ago, and the ministers said they will monitor to see what impact the measures will have and that we should be prepared that this is not the last wave that Singapore will experience.
No wave will last forever. Right? Eventually, at some point, even with after you see some of the results of our latest measures, eventually it's not going to bring the cases down, but it will slow the rate of increase, and eventually at some point the wave will crest. It's hard to tell when this will happen or what the peak will be. We consulted experts from our universities on this matter, and there are a range of different views. Some think that the wave can peak at about 5,000 new daily cases or slightly above that. Some think that it will go much higher to around 10,000 daily cases. So there is a range of uncertainty. No model can predict with absolute certainty what the epi curve will look like in the next few weeks. But it just simply means that we have to be prepared for these range of possible outcomes.
Well, visit straitstimes.com for more on today's announcements. You can also watch the full press conference on the Straits Times' YouTube channel. Subscribe by hitting the button below. I'm Olivia Quay. Stay safe, and I'll see you soon.